President Donald Trump is expected to spend another night at Walter Reed Medical Center to continue treatment for COVID-19. The president's medical team says that he's doing well, but Eyewitness News' Alexandra Limon says some questions still remain about his condition. She joins us now live from Washington with the latest.
Hi, good evening. And actually, there is now a whole set of new questions after President Trump this evening chose to leave Walter Reed Medical Center just for a short time for a motorcade ride around the hospital. He said to wave to and thank supporters who have been showing up outside of the hospital. However, that is raising a lot of questions about the safety of that decision.
I came here, wasn't feeling so well. I feel much better now.
President Donald Trump spent his second full day at Walter Reed Medical Center as he battles COVID-19.
The president has continued to improve. As with any illness, there are frequent ups and downs over the course.
Late Sunday morning, White House Dr. Sean Conley said the president is being treated with remdesivir and a steroid called dexamethasone that's shown promising results. The president's medical team acknowledges he's not out of the woods yet, but they're hopeful.
Our hope is that we can plan for a discharge as early as tomorrow to the White House where he can continue his treatment course.
In addition to the president's video, the White House released photos of the president reviewing documents from Walter Reed. Dr. Conley said President Trump's fever is gone and he's in good spirits, but confirmed the president did need supplemental oxygen on Friday and possibly a second dose Saturday. Dr. Conley's now facing criticism because he didn't disclose that information on Saturday.
Thank you. I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had. Didn't want to give any information that might steer the course of illness in another direction.
Democratic lawmakers like Speaker Nancy Pelosi criticized the lack of transparency.
We need to have trust. We need to trust that what they're telling us about the president's condition is real.
And tonight we are getting already reaction to the president's decision to leave Walter Reed for that motorcade ride. For example, from Dr. James Phillips. He is an attending physician at Walter Reed, and he said the irresponsibility is astounding, again, about the president's decision to go on that motorcade ride. That doctor says he is now concerned for everyone who was in the car with the president, including Secret Service agents, anyone else who was involved in coordinating that drive-by. He says they will all have to quarantine. He says they may get sick and they may even die. Live in Washington, Alexandra Limon.
All right, Alexandra, thank you very much.